Measles have reached the Sunshine State. A school in Miami-Dade County has reported that a student has the disease. Wink News anchor Taylor Wirtz joins us now. Taylor, what's the likelihood of it spreading to Southwest Florida?
Well, Chris, there's no way to know for sure, but one doctor I spoke with told me it is even more contagious than COVID-19, so it is something to be taken seriously. Measles is not a disease we encounter often nowadays, but with cases popping up around the country, including one at a Miami-Dade high school, experts say now is the time to assess your immunity.
If, one person has measles and there are 100 people that do not have adequate immunity, over 90% of those people would be at risk for getting measles.
Dr. Mary Beth Saunders is the System Medical Director for Infection Prevention at Lee Health. She says there's been a significant decrease in the amount of children getting vaccinated since the COVID pandemic.
With that decrease in vaccination of younger children, you're going to see one of the most vulnerable populations be at higher risk for measles.
Folks in their late 50s and older could also be more susceptible.
There was a period of time when the vaccination for measles wasn't as effective as later versions, and so those folks may indeed be at greater risk.
Saunders says those with compromised immune systems could also be more vulnerable. The good news for everyone, she says the vaccine works well.
Fortunately for us, measles is an ancient virus that hasn't changed much, unlike COVID and influenza.
But measles is highly contagious and should not be taken lightly.
Understand that, this is a serious concern.
Is in one of those more vulnerable groups. Saunders says to talk to your doctor to assess what would be best in your situation. She also says, especially in young children, measles is something to be taken seriously because it can cause long-term health complications. So it's something that you'd like to get ahead of sooner rather than later. In Fort Myers, Taylor Wirtz, Wink News.